Good evening, everybody. Here I'll talk in this topic about lifestyle and diabetes mellitus type 2. I'll present initially some MCQs, and then I will go to some summary of the topic. The first question is, which of the following statement about resistance training is true? The A, resistance training is particularly well suited for weight loss. Second, resistance training is particularly well suited for prevention of falls, and also suited for increasing muscle strength. D, resistance suited for increasing flexibility, and resistance training should be done 5 to 6 times a week by patients type 1 and type 2 diabetes. So the correct answer here is C, as resistance training is not good for weight loss, but it's really suited for increasing the muscle mass and strength, and should not be done 5 to 6 times per week, and suited to be 2 to 3 times per week probably should be the optimal frequency. So next question, what's the true statement about sedentary lifestyle for patients with type 2 diabetes? A, patient with type 2 diabetes should avoid sitting for more than 2 hours at the time. Patients with type 2 diabetes should interrupt sitting behavior after 30 minutes. C, sitting behavior has no impact on patients with type 2 diabetes who exercise more than 3 times a week. D, sedentary lifestyle is associated with less falls in patients with type 2 diabetes. Have some seconds to think about the correct answer. So the correct answer is B. So patients with type 2 diabetes should interrupt sitting behavior after 30 minutes. We'll go to question 3. Which of the following statements about carbohydrate in diets for patients with diabetes is not true? Carbohydrates are essential component of the diet for patients with diabetes mellitus. B, carbohydrate and fat should make at least 60 to 70% total caloric intake, and it's preferable to provide carbohydrate in the form of whole grain, fruits, and vegetables. D, it's essential that patients with diabetes mellitus use only low glycemic index carbohydrate. E, patients with type 2 diabetes should never ingest carbohydrate in form of cakes and refined carbohydrates. So looks at the question here, looking for which item is not true. So the answer is E. Type of diet is not important, as we know, as it's compositional. They could do it, but in small quantities to avoid wide glycemic disturbance. Question number 4, which of the following statements about the protein intake for patients with type 2 diabetes is true? So A, high protein, low carb diets are preferable to patients with type 2 diabetes. B, protein supplement should be offered to most patients with type 2 diabetes. C, diet with more than 20% calories from protein should not be offered to patients with type 2 diabetes. High protein diets are associated with development of nephropathy in patients with type 2 diabetes. Protein from fish are the best source of proteins for patients with type 2 diabetes. So take some seconds to look for the correct items. So C is true. Diets with more than 20 calories from protein should not be offered to patient type 2 diabetes. As we know, we should not recommend high diet protein. So last question, question 5, which of the following statements about fat intake for patient with type 2 diabetes is true? A, saturated fat should make no more than 20% of total energy intake in patient with type 2 diabetes. B, monosaturated fats are least desirable form of the fat diet for patient with type 2 diabetes. C, patient with type 2 diabetes should not limit cholesterol intake to less than 400 milligram daily. Patient with LDL cholesterol more than 100 should limit cholesterol intake to less than 20 milligram daily. E, fat intake is not important in patient with type 2 diabetes, so limit carbohydrate intake to less than 20% of total intake. So what do you think? What's the true item? So D is true. Patient with LDL cholesterol more than 100 should limit cholesterol intake to less than 200 milligram daily. The diet is not very effective in lowering LDL. About 15 to 20% can achieve with diet only. So think of adding medication is necessary. So here we go back to lifestyles and diabetes mellitus type 2. It makes sense to focus on weight loss in patients with type 2 diabetes, especially early in the course of the disease, because some 80 to 88% of people with type 2 diabetes mellitus are obese. Components of treatment focus many things like advice of nutrition, exercise advice, anti-diabetic medication facilitating weight loss, like GLP-1, SGL2, this new generation of GIP-1 and GLP-1 dual inhibitors, and also think of weight loss medication if indicated for the patient. And lastly here, go to bariatric procedures if indicated. So I'll talk here about weight loss and diets. Traditionally advised for patients with diabetes was eat small but more frequent meals. Actually, this was in the past when there was older insulin like MPH, and regular insulin may require that. Sulfonylurea treatment also require that to avoid hypoglycemia. But now we have treatments that are changing that paradigm. Some medication associated with weight loss. New insulin analogs allow for flexibility in the eating patterns. So talking about intermittent fasting for type 2 diabetes, actually cannot be used if patients treated with older insulin or sulfonylurea, because afraid of hypoglycemia, and this need more study to confirm benefits. Actually, it does work for patients with no or mild DM. Some patients who have mild or no DM may benefit from intermittent fasting. In this slide, we'll talk about nutritional advice. Use the nutritional program that you can stick with indefinitely and eliminate calories from fluid, and try to eliminate snacks. Eliminate snack start of the meal with vegetables and fruit. Avoid food with high glycemic index. And remember that hunger is not a disease. Exercise advice, we have to intensity is not a factor, just a number of calories burned. use very opportunity to be active. Even a short walk is valuable. Take stairs back further, go for short walks whenever you can. Try to incorporate exercise routine into every day, and monitor your weight to see that how much you lost of weight. And then thank you for watching.